Clinic, I'd use a towel, but you're just trying to get a more straight lumbar spine. And actually, all of these directions are written like in the next few slides, so you don't have to type out everything I say. What you want to do, you want to bend the knees slightly. I'm going to hook her knees on my cranial thigh and like the bend, just like this. So I'm just going to show you the knees first before we talk about the hands. So that way I'm just shifting my weight, okay? So this hand's free, actually. I can still support her knees with my right hand. And then I'm just shifting my weight as I'm testing the mobility. If it's a bigger guy, then I can always go to one leg and do the same thing, right? So I don't want to flex her up to where I'm starting to get motion yet because I want to feel for that motion, right? So I'm going to come to her lumbar spine and I'm going to feel the sacrum, okay? And then I'm going to find that L5 transverse process. I'm going to put my finger, my palpation finger, my index finger, in that interspinous space. And then what I'm going to do is grab her legs, and then I'm going to start to shift and flex her till I feel that space tighten, because you're actually tensing that ligament, that interspinous ligament. Okay, so that's what you should feel there. Once I feel that, I'm going to walk my fingers down. So that's L5. We've got L4. Okay, so then I'll put my finger between those two, feel it tense, which I do, and then come out of it. So just like with the cervical spine, feel it tense and come out of it. So you're like, okay, that segment moves, and then you walk up. That tenses, and then that relaxes, right? So the same thing, I'm not going back to neutral every time because that would just be a waste of my energy. But I'm just going to walk my body up, palpating fingers in the interspinous space. Use two legs or one leg. This one you're kind of supporting with your arm, so I tend to go just one leg, but if you are going to do that, will you straighten your bottom leg? Yeah, so I don't want to promote any flexion by having her bend her knee on the underside. Okay, but then I'm supporting her leg here. Try to start her in neutral. I find the sacrum, go up to L5 with my palpating finger, drop down so I'm in the interspinous space, and then now I'm just rotating back, feeling that space close a little bit. Okay. Then I can walk my fingers up. So it slackens. Okay, one thing you want to watch out for is that you're not abducting or rotating her, or that her body's not moving. So it's a pretty small amount of movement once you get there. So now I'm extending, relaxing, just to make sure it closes and then it opens it back up. You're starting at the top of the lumbar spine and working your way down on this one. All right. You're going to hook your cranial hand underneath their elbow. This is just to guide the upper body into rotation. Okay, and then your palpating hand, you'll actually feel what's happening at the joints. I can use my landmarks like the iliac crest is around L4. So if I do that and then work my way up, then I can be closer to L1, L2. So what should happen is that when I rotate her to her left, I'm rotating her upper body. So good body contact, it shouldn't be like this, right? So because she should be fully relaxed. If she's guarding against me, I might think that that's a hypomobility potentially. So, so I'm just slightly leaning into her and using my arm so that I rotate her. And then my palpation finger is on the lateral side of the spinous process closer to the table. So I'm on her right side of the spinous process of L1. And that is because, so that whenever I rotate her, that spinous process should do like this, into my finger. Okay, move toward the table. So that's just what I'm feeling for. When that starts to happen, okay, I'm like, yep, that one moves, work my way down, and then do it again. Remember, you don't come out of that motion. Work my way down, keep rotating, or I feel that move, yep. First, when we were doing flexion, she was on my cranial leg, the leg closer to her head, and now I'm using the opposite one. The left hand is going to be mobilizing, so I'm going to bring her into side bending this way. Actually, palpating finger is going to be in the inner spinous spaces, but closer to her right side. So more on the lateral side, but near the top. So that as she side bends, I'm feeling those spinous processes come closer together. This one you're starting distally, so near L5. So find the sacrum, come just off of that. And then I move my hands a little bit more laterally. Okay, so then I just feel for a little bit of those coming into, and so I feel her paraspinal's kicking in. So in my mind, I'm like, all right, how do I need to change my position so that she relaxes a little bit more? I can just blame the table. That would be the easiest thing. Okay. And I will say this is a little harder to feel, so just keep practicing. Same thing though, you're just moving your way down, trying to feel the motion at each segment, moving her into side bending using her legs. Okay. Behind the patient, because you're going to move them into extension and you want them to not feel like you're like pushing them backwards. All right, so what did we say was a close? So we're going to try to close off that facet and push those surfaces together and see if that causes her symptoms. So what do I need to side bend, extend, and rotate away, right? Okay, so we side bend first. Okay, good. And then we extend, pretty flexible, and then we rotate away. So most people aren't going to do this, right? But I'm trying to bring her to her end, like I can't push her anymore. Okay, if she had pain, familiar pain here, I would just stop. I wouldn't take her through the rest, right? Okay. I tend to start closer to the sacrum, so I'm going to feel the spinous processes, and then the multifidus are just right lateral to that, right? Like I fall right off of it, and that's the multifidus. Really, really close to the spinous process. Okay, and then what I'm going to ask you to do, so Carly, will you please, I'm going to ask you to lift your right leg off the table with your knee straight, and just enough so I can slip a piece of paper underneath your foot, so it's not actually very much. Good, and back down. And now can you do the other side? Same thing. Perfect. These are very nice. Nice multifidi. I'm trying to get her right multifidus to fire. What do we know the multifidus does? And I know it's eccentric flexion, but as far as concentrically, what does it do? Contralateral rotation. So it's her right multifidus. Contralateral rotation would be rotation left. So that would be this way, which just is a little bit awkward, right? Like her coming forward and kind of tensing that way. So I can still have her do the same thing, but from the pelvis. All right, so if I'm giving her pressure on her pelvis toward me, she is rotating backwards, right? So that is a right rotation of her pelvis, which is a relative left rotation of her trunk. See how we're still getting that left rotation? So what I'm going to do, I'm palpating on the multifidus right off the spinous process, and I'm just going to say, can you hold here? Don't let me move you. And I'm going to pull her toward me. Good, and relax. Now, if that's still giving me a little bit of a problem, what I can do is also pull caudally. And if she's resisting me, she might extend. So I'm trying to cue her into a little bit of extension and rotation, right? Because it's an extender and contralateral rotator concentrically. So I'm pulling toward me, and I might also pull inferiorly slightly so that she extends. Okay. All right. So hold here. Don't let me move you. And relax. Again. And relax. Okay. So that's how you can just activate. If whenever you assess that you're not feeling much activation, or if someone's pregnant or they can't lie prone. Okay, so now take a step forward. This one you probably will feel. Take a step forward, and once your weight shifts onto your forward leg, you feel that? Which side? Ipsilateral or contralateral? Contralateral. Prone instability test. So if you think someone does have some of this muscular instability, you might do this test for them. Okay, so what they're going to do, they're going to start here at the table, and then they're going to lean forward so that your hands are supporting your trunk on the table, but your feet are still on the ground.
Okay. So here?
Yep, and just kind of lie down on the table. Perfect. Okay. All right. So from here, the back's nice and relaxed, feet are on the ground. You can do your PA testing. All right. So let me know if any segments are more painful than others. Oh, that one? Okay. It's going to provide pressure, and I want you to think about how it feels right now. Then I'm going to ask you to lift your legs. I'm going to do the same amount of pressure, and then I want you to tell me what you felt, if they felt the same or different. Okay, so this is the segment. I'm thinking about how much pressure I'm giving so that I give the exact same amount of pressure. Okay, now can you lift your legs for me? Hold it. Legs back down. Okay, you can stand up. How do those feel? So that's what you'd ask. And what's the difference? Okay, so I'm not leading her. I'm really just asking what's the difference side to side. Okay, so I'm not maintaining the pressure as she's lifting. Okay, I'm not providing stability to her back as she's lifting. That's what people sometimes will tell us, like, oh, I'm giving her stability. What I'm doing is I'm testing if her back muscles are relaxed and I provide pressure, if that's painful. If I then ask all of her extensors, that big muscle group, to stabilize her low back, I provide the same pressure. Is that better, or is it the same, or is it worse? If it's better, then she might benefit from some more dynamic stabilization. She might benefit by if we increase the bulk of those muscles to give her more stability. Well, a positive test would mean they might benefit from dynamic stability. So positive test is I lift my legs on that second round. She lifts her legs. When I provide the same amount of pressure, pain is less than the first time. I'm going to start most caudally, so L5S1. I'm using his knees, and they're bent. I'm going to put his knees on my most caudal leg, and then from there I'm going to push this way using his legs as a lever to try and shear that disc. Okay, so my left hand is stabilizing as best I can the segment above and really just feeling to make sure I'm getting some movement through the segment that I want. But my pressure is all going to go through my body here, pushing through his leg to try and shear that disc. So this one talks about your stabilization finger. You can cross your middle finger over your index to block. So in this case, L5. My right hand, I'm just putting it on his legs to help me support them. And then from here, I'm just going to push right through. I could, if I felt like I have really good stabilization there, I can feel here just to make sure I'm getting some movement. But it's more just palpating. Okay? And if that disc is on fire, then it's probably not going to like that. All right. You could also then move up in the segments and do that at different levels if you'd like. Because that's what we're trying to do. We're trying to tense it maximally and see if that reproduces their symptoms. What do you think for the knee? Extended. Yeah, if we're thinking sciatic nerve. Good. Okay. And this isn't the test right now. I'm just talking you through it. Okay. And then what about the foot? Good. And then what about the head? Yeah. Yeah. Okay. All right. I'm going to hold her into dorsiflexion. I'm going to slightly internally rotate the hip. I'm going to lift the leg slowly and just ask if she has any reproduction of her symptoms. Okay, and that might happen though. Someone's like, oh, I've got like tension back here. One, is that your symptoms? And if it's not, okay, say we find your symptoms, come out of it just a little bit, and then we're just gonna confirm with moving her head, right? So can you lift your head up and then back down? So if she feels her symptoms here, I came out of it slightly. What do you think she may feel if she flexes her head? Symptoms return, right? So I would just say, can you bring your head up? How does that change your symptoms? And then back down. Now you can just they should say that they go away. Okay. And actually, you're up on your elbows, and yep, you're gonna start with your head up, actually, right? Because flexion is still gonna further tension even though we flip. So we do want to start with her head up. Okay, so we're gonna flex your knee to tension the femoral nerve, and then does that reproduce any of your symptoms? And then if she says yes, I start to feel it, then you come out of it. Yep. Okay. Because when she was on her back, even if she had hamstring tightness, would you expect the hamstring tightness to change if she moved her head up or down? No, right? Mm-hmm. Okay. All right. And that's what we're going to see with our slump test next too. So we can. So I'm going to. It's pretty much the same as a straight leg raise lying down as far as mechanics, except she's just sitting. So I'm going to say, all right, you can slouch. And then my joke is this isn't the only time you can slouch in PT, so enjoy it. So you do want her to be slouched. Passively dorsiflex and extend. And then I'm holding her shoulders here because, does this reproduce your symptoms? And she has her head down. And then if so, what happens if you raise your head? So my hand's here because sometimes what people do is they'll sit all the way up, and I only want her head to move. I don't want it in any way to influence her trunk or even her pelvis, because then that could influence her hamstrings. Okay. So if lifting their head, that should relieve their symptoms, right?
Yeah, I felt that one.
Did you?
Mm-hmm.